Good afternoon, everybody. Here with Josh and Paul, of course, and two special guests, Miriam Delphin-Rittman, maybe you know, Department of Mental Health and Addiction Services, given the fact that COVID has affected our physical health, and it's also affecting mental health. Some comments on that. And Charlene Russell-Tucker, filling the big shoes left by Miguel Cardona over at State Department of Education. and here to talk a little bit more about what our schools are going to be like starting in July at the end of the school year and going forward, and how the American Rescue Plan impacts that. First, a little bit of a COVID update. What you see on this chart, which I think is interesting, is the number of tests is going down. We were averaging or had up to 300,000 tests a week, and now you'll see we're down to about 200,000 or so. I think a lot of the worried well are not quite as anxious about getting tested with quite the same frequency. I think you see the positivity rate staying relatively low. It's not going to go down to zero. People maybe self-select a little bit when it comes to testing. Maybe they, wait until they feel some slight symptoms before they go. But if it was me, and it is, go get tested when you get the opportunity. There's plenty of capacity there, gives you some confidence, no cost at all, and allows you to see where you stand. Hospitalizations continues to go down, and fatalities down at 9, which is the lowest, number we've had in some time. So I think it gives you an idea that while the positivity rate is still lingering in the 2 to 3% range, they tend to be sort of a little younger, a little healthier, maybe the folks who are getting infected, and that means our hospitalization and fatalities continue to go down, which is good. Vaccine update. All right. Over half of our people over the age of 55 have now been vaccinated. 76% of the people over the age of 75. Not a big increase from the last, few days when we were here. So that reminds you that, you get up to 75, 80%, it starts tailing off a little bit, which is not a good thing. We're going to have to work on making sure that everybody, especially in these most vulnerable age groups, do get vaccinated. Right now where we have demand outstripping supply, we'll relax on that a little bit. 67% of the people 65 to 74 have been vaccinated. So the overwhelming majority of the folks who are most at risk, over 65, have now been vaccinated. 32% of the folks 55 to 64, that's up from, I think, 25% just a few days ago. So that number continues to go up. There's still strong demand in that age group, but we'll be letting you know what the next phase is early next week. Almost 30% of all of our adults have now had their first dose, and that's making a world of difference. We still have some work to do. We still have some work to do when it comes to our most underserved populations, the black and brown population. We call them the most socially vulnerable zip codes, the SVI zip codes. We've made a big effort. We got to do more when it comes to these populations, make sure that they get vaccinated. Black and brown populations, most likely to get infected, most likely to suffer complications, most likely to be living in multi-generational housing where it's not as easy to quarantine, and often most likely to, be going to work. So we're really making a big effort there. Here's how we're doing. We've broken it down by a category of healthcare provider. Basically, you can see that if 25% is our benchmark, that's the percent of the population and the socially vulnerable we want to get vaccinated. We've allocated those vaccines to them. Right now, we're at about 20% of that population. Making progress, still have a way to go. You can see on the chart, the federally qualified health centers right in the community, they're hitting their target. Maybe that'll be more of a priority for us. The hospitals with the mobile vans and the telephoning out, making appointments, sometimes going door to door, real outreach, getting close to the 25%, got to do a little better. Local health departments, okay. And the pharmacies, less, 14%. Pharmacies, a little more, you come to us, you make an appointment online. So a little less likely to be able to get that population. So we're working this. We're working it hard. We've got some a way to go. We really appreciate the ministers and other advocates who have stood up, talking to your communities. We've got the mobile vans out at your churches after the service, and we're going to get there. Let's move to education. a lot of money came through in the American Rescue Plan and over the last period of time. And previous to this $1.1 billion allocation to the state of Connecticut, we had $492 million that came through, in the previous December bill. Let's say we have about $2 billion that we do every year in terms of ECS, cost-sharing formulas. So we've got a fair amount of additional revenues we're going to put to work to help the kids. And here, we really are going to think broad and think big, because there are probably, our schools have been open pretty much since September. 95%, 98% of them are open for in-person learning now, most of it full-time. But there are still close to 200,000 kids that haven't been in the classroom, feel unsure, feel unsafe, most at risk, mainly in our urban communities. And what you're going to hear from, Charlene in particular is how our outreach is to these kids and what we're going to do with these revenues to make an enormous difference in their lives, knowing that we want them to be ready to learn in September. And that means getting back together with their friends, socializing, summer camps, and learning to get up to speed. We'll be starting that, soon in July, right at the end of this school year. We'll be learning for college credit as well, and summer internships for the older kids, just to get them socializing with their friends and thinking about learning again. They don't need more Zoom. They don't need more computer instruction. I think what we do agree is they need more socialization with their friends, their peers, and mentors and teachers. And that's going to be some of our priority that Charlene's going to talk about. And next is mental health. In particular as it impacts our kids. You've heard me say before, and it breaks my heart, that those 211 hotlines that we get, often they're kids, kids who haven't, or feel just in stress, who have been isolated for an awful long time. And these are kids that we're going to pay special attention to as we get back in our summer programs and then our new school year. And Miriam will talk a little bit more broadly about the kids and the broader community in terms of what we're doing with the Rescue Act money to do everything we can to take care of this population, help them get back on their feet. We see it reflected in substance abuse. We see it reflected in at least threats or worries about suicide. And these are priorities that we're going to have going forward. I can't think of a more important time, this is what I'm telling the commissioners, to think big in terms of our opportunity to take care of these populations that have been hit the hardest. We're going to be working closely with superintendents of schools, working closely with legislators, getting the chairman of education, the education committees to give us their best ideas. So we don't have 169, Charlene, different districts all doing their same thing, but taking the very best ideas we can to make sure our kids hit the ground running. Charlene, welcome.
Thank you, Governor, and thank you so much for the opportunity to serve our families, our educators, and our students. And thank you for your leadership in this space, because it is so critically important. And as the Governor mentioned, it truly is an opportunity for us to think big and to mobilize the many stakeholders and the best that we have offered in Connecticut so that we can address our children learning, we can address recovery, and we can address acceleration. As the Governor mentioned, we're bringing everyone together, stakeholders. Where are our libraries or museums? And working with the Office of Early Childhood to think about our summer camps. How do we do this to make sure that the resources are available and the programming is available for our kids to certainly participate in? So that is something that we're moving forward with. Also working with the Office of Workforce Strategies, as the Governor mentioned, looking at efforts around college credits and also about internships. So those are really critically important. And the Governor also mentioned that this is about kids learning in a fun way, which is truly important. It's not about sitting and Zooming all day. We talk to our students, and that is really important. So we wanted to know what they think about their education and what needs to happen. And we heard loud and clear from them We used a crowdsourcing platform to gather information from them, and back in June, we heard from about 16,000 of them. A couple of months ago, we heard from another 8,000, and the message, listen to us, they say, facilitate social connections, use engaging in fun activities, and help manage mental health. So as we look at the resources that we have, we must focus on the learning recovery. We must focus on also social emotional learning and safety, which is so critically important. So we will be working with the behavioral health providers. We will be working with our districts to make sure that we have our social workers, our school counselors, our school psychologists, and more partners to be able to support children and families. It's been unprecedented in terms of what not only our students, but also our educators have experienced. And we must make sure that they are doing well in order for our kids to make sure they maximize their learning. So we're really thrilled to be able to work with all our partners. We're bringing you to the table so that we can think, have bold, audacious goals in order to support our children. Thank you, Governor.
Hey, well said, Charlene. Good. You got 30 days. Roll out the plan. I'm looking forward to it. And Miriam, you've been on the front line. Tell us what you're hearing.
Okay, sorry about that. I was on mute. But thank you, Governor, for the invitation to be here and also for your leadership. Commissioner, I look forward to our continued collaborations, and particularly as we're moving forward and looking at ways to address the needs of students. Governor, I mean, one thing that we're hearing just consistently, and have heard consistently throughout the pandemic, is that the pandemic it's been a struggle for young people. Their everyday routine was significantly disrupted. And so many young folks talked about feeling sort of isolated and feeling alone and feeling disconnected from each other. So we know the return to school is so critical in terms of helping kids to be connected again to teachers, to school programs, to other students. One thing that we're hearing also is even in terms of adults, we're seeing lifespan impacts of the pandemic, and that adults as well experiencing significant sort of anxiety and depression as a function of the uncertainty brought about by the pandemic, whether it be uncertainty related to job stress or uncertainty even related to how their kids are doing. And so we are very grateful for the federal resources that we'll be receiving from the American Rescue Act. It'll be a really important opportunity to work across agencies and to think creatively around ways to address the gaps any gaps that we may be seeing. One area that we know is where there have been challenges is we've seen, again, young people who've been particularly at risk for feelings of suicide or depression. The additional resources that are coming in will focus on suicide prevention programs and activities. And so that's one area that we'll be working on. There are also resources focused on community mental health programs and initiatives. And we know that's so important. So things like mobile crisis. So being able to work with children or families if they're in distress, and have mobile teams that are able to go out and meet with people if they're in distress. So we'll have resources for that. Also for individuals that are struggling with substance use issues. There are resources to be able to scale up and expand substance use services and supports. So we're grateful for the resources. We know that there'll be significant opportunities to scale up many of the programs and services being administered at our community mental health centers, also our school programs that are addressing mental health challenges. And so looking forward to continue the partnerships to address the range of needs that we're seeing emerge as a function of COVID. Thank you, Governor.
All right, thanks, Miriam. So in addition to Miriam and Charlene, we got the usual suspects, and happy to take your questions.
Channel 3 Eyewitness News.
Yes, Governor, it seems as if the demand in this 55 and up tier really hasn't subsided. People are still struggling to make timely appointments. Some people are finding their first dose in May. What impact is this going to have on the next tier that opens up on March 22nd?
Well, we're getting an awful lot of people vaccinated in the 55 and above age group, as you know, and we are getting more vaccines every week. So Matt, as we said before, don't give up and don't assume you can't get that appointment before May. We're opening up well over 100,000 appointments on a weekly basis. So the trick is to keep coming back until you get a date that's better. And I'm pretty sure that you had the first rush of those 55-year-olds was recent. I think you are going to see a little more opening over the next week or so.
Got it. And my final one here is, as we mark the 1-year anniversary of COVID in our state, President Biden, he's going to speak on it tonight. When you reflect, in your opinion, what are some of the things that we got right, and what are some of the things that we might do differently in hindsight?
We were learning on the fly, that's for sure. You saw that picture. We're all standing there in Danbury, nobody wearing a mask, and the president talking about hydroxychloroquine and Lysol. But I think Connecticut learned pretty fast. I think we worked with the healthcare professionals. They took the lead for us. The hospitals were incredibly valuable. I think that was all great. If we'd done everything earlier, it would have been better. Obviously, when it comes to the PPE, there was no stockpile in Connecticut. There was no stockpile in Washington, D.C. And let's face it, we were scrambling. So I wish we had started earlier, but we started as early as anybody.
News 8. NBC Connecticut.
Good afternoon, everyone. For Commissioner Delphin Rittman, as well as Acting Commissioner Russell Tucker, what do you feel like will be the biggest obstacles, challenges as we transition back to that post-pandemic world?
So, thank you for that question. And we still have, when we think about the families and what they've encountered and been engaged in, the basic thing of feeling safe coming back into a school environment. We're hoping actually that as educators are vaccinated and more families are also in that space, that there will be that feeling of re-engagement to really, as we are addressing social isolation. So working that through will certainly be that's something that we have to pay attention to. Our educators or superintendents are working hard as we're transitioning back into more in-person learning and more person density. They're working with that as well, and I think that's going to position us well as we go forward.
Yeah, and I would add to that. I mean, I think, one thing that I'm hearing is that, people have to work on their comfort level, trusting that, if they're vaccinated and the people they're working with are vaccinated, then with the appropriate PPE, as necessary, that it can be okay to go back into a work setting or okay to, engage with family or friends. Again, with the appropriate precautions, once individuals are vaccinated. So, one thing I'm hearing about is, people may have struggles with just managing some of the post-pandemic anxieties around, is it really safe now? Is it really okay to re-engage? And so I think just messaging around that is going to be really important, and certainly one thing that we're working on with staff, letting them know about sort of what's okay and what's not, what some of the precautions that we still need to think about, even once an individual is vaccinated.
And Commissioner Delphin Rittman, we talk about mental health, and it's not something that can be solved overnight. Do you feel like this is something with the funding that's been given, that this is something that can be met and fully dealt with?
Yeah, so with the resources that we've been given, it's created an opportunity to really think broad and wide in terms of community-based programs, in terms of prevention programs, even public awareness programs related to what mental health services and supports are available. You're right, though. I mean, things aren't going to change overnight. And so, certainly one thing that I think is critically important is just for people to know about the services and supports that are available. And to know that if they're struggling, they don't have to struggle alone, that there is help available, to include teams that can come to their home if necessary, to do assessments to appropriately connect people to services and supports. So there are resources that are available, and the new resources will allow us to scale up the services and supports statewide.
And Governor, I want to feed off of Matt's question a little bit here as well. You know, just reflecting back over this last year, just kind of what have been your overall thoughts? You know, maybe less about the choices, but just more overall your feelings and your thoughts.
That the people of Connecticut really rallied. That we were all confronted with something that was totally unknown and alien to us, and we had to work on it together. We had to give each other the benefit of the doubt. We had to do things we never dreamed we'd ever ask anybody to do. Wear a mask, close down a school, can't go to a restaurant. And I think people understood why we were doing what we were doing, and we worked together. And my hat's off to the legislature. It was a deep politicized situation. We worked together hand in hand, and I really needed the legislators because we needed all the advocates out there in the community reinforcing the message. And I think it helped us get through this together.
Thank you.
Fox 61.
This question is for both commissioners. We talked a lot about focusing on helping children catch up with this money coming from the rescue plan. Do you have a message for parents, maybe the parents that are listening, as to what they could do to help ease this process back to somewhat normal?
You know, I mean, it's a good question, and you know, thank you for that. I think one thing that's so important is just communication. You know, having conversations with kids often around sort of what the process of going back to school will be like, or what the process of re-engaging in the various ways the kids may be re-engaging in their lives. So I think creating that space to have those conversations with kids and young folks around any of the concerns or fears they may be having, I think that alone goes a long way, because we know young people listen. They listen, and they often sort of soak up what the adults in their lives are telling them. So I think communication is really critical there.
And thank you, Commissioner. And I'll add the need for supports. The Department of Education has taken on hosting webinars directly with families and for families. And we have one that's upcoming about mental health and social emotional well-being, so that they themselves who have taken on an enormous amount of effort this past year in supporting their children's learning, that they can also take care of their needs or get their needs met in this space as well. Because if they feel okay, then they're better able to do the task that's in front of them. And so continuing to provide that level of support for them, I think, is critically important. I know some districts are really working very well with their families to make sure that there is that dual communication back and forth, and that truly is critically important as well.
Thank you. And then, Governor, earlier this week, the state reported 15 new cases of the B117 variant of the COVID virus. As more people become vaccinated, is there any new updates regarding the current vaccine being successful against this variant and the other variant first found in South Africa?
Yeah, right now the good news is that the vaccine seemed to be pretty successful against both of the variants that you said. Secondly, mRNA, which is the Pfizer and Moderna, we can adapt that based upon which variant maybe becomes prevalent here if we have to make a booster shot later on. And finally, while the variant may be expanding as a bigger piece of the infected community here in the state of Connecticut, it's not reflected in higher infection rates, and that was very important.
News 12 Connecticut.
Good afternoon, Governor Lamont. What is the plan to get people with underlying conditions and comorbidities vaccinated?
The plan is, as we go forward right now, the overwhelming majority of the folks who suffer complications from a comorbidity are over the age of 55, and they're going to be substantially vaccinated, I'd say, within the next week, 10 days. And then we're going to move into the next category. So I think we're taking care of the folks with comorbidities who are most at risk.
A follow-up I have is, are you aware, and if so, what is your take on Connecticut residents with these underlying conditions who are eligible in other states of crossing that state line, this state line, and getting the vaccine elsewhere?
Well, I know it's a little helter-skelter in some of the other states where it could be sort of first comes, first served. So I understand that inclination. But I tell you, here in the state of Connecticut, because we've done this on a pretty disciplined basis, we're able to move through those folks who need the vaccine faster. And I think you're going to find within 6 weeks, everybody who wants a vaccine will have that option.
WTIC 1080 News.
Hi, Mr. Governor. Production and supply are picking up. We're still hearing about communities of color not getting vaccinations at a comparable rate. Do you get the urge to put your General Marshal helmet on and get a bunch of big trucks like in Stripes and overwhelm the cities with a grand gesture, which is obviously doses for all when you can?
Yeah, or ask Josh Jabal to do that and get those mobile vans out there and get more mobile vans and bring the vaccine to the community if the community is not going to come to us. But Josh?
Yeah, I mean, you know, we are working with our partners in our cities and the other towns that have high SBI zip codes to do the modern day equivalent of that, which involves things like mobile clinics set up in community senior centers, at churches, doing door-to-door campaigns to sign people up to get vaccinated, doing outbound calling into people who are eligible to encourage them, answer their questions, make sure they're comfortable getting vaccinated, and then sign them up directly. So, you know, lots of ways that people don't have to, you know, navigate technology, or that we're being, as a state, with our leadership of our hospitals, our local health departments, our federally qualified health centers, being very aggressive about reaching out to people. But as the governor said earlier, and as the data show, we still have more work to do. And we're going to continue to focus on this. We've got another meeting tonight with the healthcare providers talking about strategies, more that we can do. But it's city by city, neighborhood by neighborhood, working together with all the partners there to get the outreach done and to get people signed up.
And I'll also add, Governor and Josh, it's also answering people's questions and providing that opportunity for people to ask questions and get the clarity. We know that in these various communities, I know I've served on many various panels on these various discussions. There's a lot of questions that the individuals are asking. And so we've made it a priority of our administration working with, for example, the New Haven Board of Alders and other entities to set up as many venues as possible to answer questions that people may have as well.
Paul, you think that availability is there and yet it's being rejected by a lot of folks still?
I think, as the governor stated and Josh stated, there's always more that we can do, and that chart shows it. And that's why we're going to continuously work with the providers to make sure they know that this is a priority. With that said, we have also heard that people also want to ask questions and learn more and have a better understanding of the 3 vaccines. So we're going to do all those parts. It's not one or the other. They're both together. And that's the thing that we're going to focus on in this administration under the governor's leadership.
There will be a point this summer maybe where we won't be talking about the cities lagging in this area, that we can catch up?
Yes, we're going to make sure, do everything within our power to make that happen. But look, we're going to find, I think, that at some point supply outstrips demand, and we're going to be really working hard to get those folks that maybe feel like they don't have to get vaccinated, to remind them and tell them, make it easier, get vaccinated.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, yesterday more than, I think, 100 long-term care workers blocked traffic outside of the Department of Social Services. They're trying to draw attention to their push for better wages and benefits, especially given the pandemic. Their union's been very critical of your budget for not doing enough to help this situation. Would you consider using more of the federal relief funds for this situation?
Yes, so we definitely will take a look at that. As you know, we provided about $100 million in additional funding, for the nursing homes during the last year. And we asked them to prioritize combat pay for the nurses who had been on the front lines. As you know, we made sure those nurses were the very first in line to get vaccinated. Took a little while, but did everything we can there to make a difference as well.
Do you know how you plan to, or how you would like to spend that additional federal funding that we got that was up above and beyond what you had in your budget?
Let me talk to Deirdre and Melissa on that, and I think they're having some conversation. But let's face it, the folks in the nursing homes has been on the front line. Thank God today it's one of the safest places to be because everybody has been vaccinated. And my heart goes out. During those early days of the pandemic, those folks were going to work every day, and we were scouring the globe to get the PPE people needed.
And for Acting Commissioner Russell Tucker, are there any concerns about students not being ready to advance to higher grades, given that so many of them may have been online over the previous year? And is there any talk of maybe having mandatory summer school?
So thank you for that question. It is really the work that we're doing right now. And when we talk about learning, we're talking about learning recovery and acceleration. And we really believe with our superintendents and everyone working together with our partners that we can really work very diligently over the summer to make sure that we can address the losses and certainly some acceleration and do the recovery. So that is the work that we're doing right now, which I think is so critically important. And we will be able to assess as well to see where our kids are and then be able to focus our efforts in what we need to do going forward. If we do this well, and I know we will with all our partners, then we'll be able to make sure that families and kids have access to, as I said before, summer camps, to be able to have museums, to be able to have libraries, to have places where we can work together and say learning is occurring everywhere, every day during the summer. And I believe that will go a long way for us to be able to address the recovery.
Okay, thank you very much.
Connecticut Public Media.
Good afternoon. What do the vaccine coverage rates look like at nursing homes now that we're 3 months into eligibility? And what is the state doing to identify and monitor individual facilities that are still struggling to get a majority of its staff or residents vaccinated?
Are there many of those nursing homes, Josh?
Well, yeah, I mean, when the federal nursing home vaccination program concluded, we had exceptionally high uptake amongst residents in particular. We think we were getting 90 to 100% uptake in almost every nursing home. Our concern now starts to shift a little bit to, in many of these facilities, the population does turn over, especially some of the rehab facilities. And so our team at Department of Public Health has set up something we're calling Project Matchmaker, which is essentially ensuring that every nursing home, even now that CVS and Walgreens have kind of moved on and that federal contract has ended, that they're all connected with a vaccinating partner. So as they get new residents moving in, we're making sure that they're getting vaccinated as well and that we're staying on top of that. So that is an area of focus going forward that we've got a close eye on, and we'll make sure we keep those vaccination rates up extremely high as they were when the federal program ended.
And the CDC tweeted yesterday that the risk of severe COVID-19 illness rises sharply with the increase of a BMI, especially if you're under 65. What would you say to people who are overweight and obese and have to wait another 2 months to get vaccinated?
Want to take that, Josh?
Yeah, well, as the governor alluded to earlier, you know, the data are very clear in Connecticut and in the United States and around the world that the people who are dying from COVID-19, it correlates very strongly with age all the way down. And so, you know, for people who are 55 and above, whether they're overweight or whether they have any other pre-existing conditions that put them at higher risk, they're obviously all eligible now. And as we keep going down the age groups, we'll get more and more of them. But even as we look to the next phase, you know, the 45 to 54 group, which will be opening up very soon, you know, people in that age group have died at a rate that's 14 times higher than 16 to 34, the kind of last tier. So each step of the way that we go down in age, we're picking up the next most at-risk group of people. And as the governor said, this is moving very fast right now. And, you know, within a month and a half, everybody will be eligible. And so everyone, even if they're younger, they don't have much longer to wait.
Thank you.
The Day of New London.
Thanks. It's Julia Bergman with The Day. Two questions. The first is, if you see people in a certain age group, you kind of meet the threshold, and as many people are going to get the vaccine, are going to take it, would you consider opening up to some of these other groups, like people with underlying health conditions, or would you consider opening up to, the next age group?
I think we're going to be looking at the next age group pretty soon because, Julia, while you maybe say, hey, we're at 35 or 40% right now for the 55 and above, every town is sort of different in terms of their mix, and we've got to make sure that every vaccine is used. So we find that half the towns have 65% of that population vaccinated. At that point, we're going to open up to the next age group. So as Josh said, that's probably about 10 days away.
And then you indicated that the federally qualified health centers were doing well as far as the equity targets. Would you consider giving them more vaccine doses than other places, given that, sort of as an incentive?
Makes some sense, Josh. What do you think?
Yeah, we have been doing that in many cases. In particular, not just the federally qualified health centers, but the local health departments and the hospitals that are doing direct kind of targeted clinics in these communities, in these zip codes. We're making sure that they have, the vaccine that they can handle to meet the demand. So, yeah, we are looking very carefully every single week at the providers who are, have the capacity to do more in these zip codes, and we're making sure they have the vaccine they need.
Thanks. And lastly, with the Johnson & Johnson vaccine, is there any consideration to giving that to maybe more vulnerable or hard to reach populations, given it is just one shot, or is that already happening?
Yeah, that is happening in many areas. We're really following the lead of our providers in terms of what they're requesting to serve their populations. As we've talked about in the last couple of press conferences, the supply of J&J this week and next week has gone down quite a bit. So it's less of a focus right now, but as it ramps up towards the end of the month, we're excited to have that, because that kind of one and done model for J&J is very attractive for a lot of people. Not just for those mobile clinics, but I've heard that from a lot of different folks as well, which is great because it's an extremely effective vaccine in preventing severe illness and death, and we're trying to get it out to everywhere we can.
CT News Junkie.
Thanks, Max. Governor, you might have noticed the insurance company, the legislature's insurance committee, they altered their bill today on a public option. I was wondering where you stand on that issue. Do you support allowing the comptroller to sell health insurance to small businesses and nonprofits and that kind of thing?
I support innovative ideas that bring down the high cost of health care for working families and small businesses. Hugh, our plan is the focus is more on the underlying costs rather than who pays, and so we have a plan to hold down pharmaceutical costs in particular, since that's been going up at double digits. In addition, you're right, the controller and some of the other insurance companies are working on preferred networks that give us the best opportunity to work on hospitalization costs as well, where there could be a real differential. And today I was at one of the companies that are focusing on health, basic health, doing everything we can to keep you out of the hospital. So those are going to be my priorities, to make sure that healthcare stays affordable. And I will say, as part of the President's Rescue Plan, there's significant subsidies on the exchange that are going to bring down your cost to purchase healthcare dramatically. So you'll see an impact on that very soon.
All right. Let me take another swing there. You said you support innovative ideas. What if that innovative idea was what the comptroller was looking for, like the public option? I'm trying to nail down your position on the public option here.
Well, if the public option means the taxpayers have to underwrite the risk, I've got some real questions about it. If the option means we're going to have a preferred network that incents people to go places where you have high value and less cost, let's take a look at it.
All right. Josh, I was wondering if you had any update on the vaccine coverage in prisons, where it stands with the inmates and where it stands with the correction officers.
Yes. we are over 2,000 offenders have been vaccinated, and we're continuing to make fast progress working through that population, again, working backwards by age. And all correctional employees, our correctional officers have been offered vaccination, and obviously will remain eligible, as we go forward.
There were some concerns early on that somebody had polled them, and they were anticipating low uptake among the COs. Has that, what has it been like? Have a lot of them been taking it? Do you have any numbers there?
Yeah, I think we've gotten up around 50%, which is not uncommon. We saw this in the nursing homes first round for employee vaccinations. Oftentimes we start out a little lower than we'd like to be. And then, as Paul alluded to earlier, with more opportunity to answer questions for people to see their colleagues, their family members getting vaccinated, we expect those rates to go up over time.
Okay. Thanks, everybody.
The Hartford Courant.
Hey everybody, this is Emily Brindley from The Current. I would like to return to those equity targets. So Josh, you'd mentioned that you or somebody from the state will be meeting with vaccine providers. I think you said tomorrow. Could you, I guess starting there, could you kind of outline the state's plan for assisting vaccine providers in reaching these targets? Because obviously pharmacies especially seem to be pretty far behind.
Yeah, absolutely. So we have been meeting with them regularly already. As I mentioned, there's another meeting tonight, and they will continue. But it really is talking about strategies that can be deployed to help ensure that people who live in those high SBI zip codes not just have access, but are actually getting vaccinated. Right? That's the most important outcome that we're after here. And so strategies that we've seen some of these providers employ with some success are things like I mentioned before, mobile clinics into these communities where people don't need to sign up in advance. They don't need technology. We bring it directly to them. In some cases, we have providers who are now reserving, a proportional number of appointments for people who live in those zip codes, literally kind of setting that aside so that as people from those zip codes call in, they can get appointments without having to compete with the rest of the state. Door-to-door campaigns, outbound calling. There's a lot of providers now who are doing outbound calling into those zip codes. So there's a wide variety of plays that providers are employing, but we're talking to them about what's working, what's not working as well, where we can double down, where more resources and focus are needed, and making sure that we've got the vaccine allocation aligned so that they can meet their goals.
So from what you're saying there, it sounds like a lot of this is being done over conference calls or something like that. Is the state also providing some more concrete, like step-by-step guidance? Because I can envision a vaccine provider who would very much like to reach these goals, but doesn't know how to set up a mobile clinic, hasn't had that experience before. Is the state providing like a blueprint that they can follow to actually implement some of these strategies?
That's not really needed. I mean, it's less complicated than you make it sound. I mean, we are there to help support them with whatever they need, and DPH does play an important regulatory role with regards to vaccine clinics in particular. But the techniques that are required here, many of these providers are already doing this, and it's really about continuing to scale it up, continuing to add more mobile clinics, more outbound calling, more dedicated appointment slots, more education, more trusted messengers out in the community, more community partnerships. So we're going to keep pushing them and keep working with them on that.
And will those equity targets, the percent allocated for high SVI zip codes, will those change as the eligibility criteria change?
Yeah, good point. As we open up to the next phase, then, for example, when we get to 45 and above, we'll reset what that target will be based on the newly eligible population.
Okay, great. And one unrelated question for the governor. Governor, with the new relief package, obviously a lot of money is flowing into Connecticut's towns and cities. Do you anticipate that all of that money will go toward COVID-related expenses? And if not, do you have a preference or suggestions for towns on how they should spend that money?
I think it's broadly defined as COVID-related expenses, but as you heard from Marion and Charlene, for example, when it comes to mental health, when it comes to education, that's broadly defined. We've also found a lot of our towns and cities had additional public safety costs. So Melissa McCall is going to be coming out, with the guidance when we get it from Treasurer and exactly how that money can be spent. And I look forward to working with the mayors and first selectmen to be creative about how we make sure this money makes a real difference for them.
Thank you, everyone.
Thanks, Emily.
Hearst, Connecticut Media.
Hi, Governor. I wanted to follow up on a question that was asked a little earlier this week. Is there a reason for the lower percentage of people who have been fully vaccinated versus those who have received just their first shot? And are you having a hard time reaching people to get their second dose?
I don't think that's the problem, Peter, but Josh, you said it was an accounting issue coming out of CDC.
Yeah, if what you're referring to is the data that CDC is reporting, as we mentioned last time, that we've identified with them an issue with how they're importing data from the various systems that Connecticut providers use. Where it's up to about now 81,000 doses that they have misclassified that are actually second doses that have been administered that they're counting in their data as first doses. The good news on this topic is they have committed to us that they understand what the fix is that's required. They're going to do a restatement of that data. We understand tomorrow night, so that by Saturday, the data should be properly reflected in the CDC systems. But the data that we're sharing in these reports from the governor are accurate.
Thanks. And then for you, Governor, a former spokesman for the Department of Public Health filed a lawsuit claiming he was fired for escalating concerns to your office. My question, do you support the right of state workers to file whistleblower complaints, whether or not they're part of a union?
Absolutely.
All right. The positivity rate also bumped up slightly over the last few days. Does that affect the plans for reopening, for lifting the cap next week? And do we have any idea what that might be caused by?
I think it's been consistently pretty low. And most importantly, Peter, as I pointed out, those that are infected tend to be a little younger, a little healthier than they were, say, 6 months ago. So our hospitalizations, complications, fatalities continue in the right direction. So no change in plans.
All right. Thank you all.
The Connecticut Mirror.
Thanks, Max. Earlier today, the Hartford Hospital had a press conference, and they were talking about how their testing is about 50% lower than it had been. And the governor just mentioned how testing seems to be going down. Is there a plan on, when we're going to scale back testing in general? And what's going to happen in the nursing homes? If I remember correctly, I think it's the end of this month that I know they test the staff weekly now. Is that going to continue? What's going to happen with the nursing homes?
I'll start and then Josh jump in. But I will say that when you have close to 30% of our people have had their first vaccine, there'll be a little less urgency for more and more of our population to get regular testing. So I think you are going to see those testing numbers go down and perhaps just a little more confidence out there in the population as well. Josh, anything to add?
Yeah, no, that's exactly right. And, the CDC's been clear that once you've been fully vaccinated, even if you have an exposure and you're asymptomatic, there's no longer a need to get tested. So the governor's right on. I think the demand will subside over time, but there still will be large populations, particularly children, who aren't even eligible on label at this point. And we are in discussions between DPH and the industry and the nursing home industry specifically about how we want to handle the repetitive testing in nursing homes going forward, given the very high vaccination rates. And we'll may have some further announcements on that in the coming weeks.
That ends at the end of March, right, Josh? Am I right about that? That the nursing home testing, something has to be done the next couple of weeks?
Yeah, we've kind of been extending it, couple months at a time for the last 9 or 10 months. So there's nothing magical about that date, but yeah, it is something we're taking a close look at.
And my other question dealt with the chart you put up earlier about the different groups and whether they were reaching their goals. Obviously the pharmacies were significantly lower than anyone else. Is the state still giving them vaccine, or are you just relying on what they're getting from the federal program? Or are we still giving vaccine to them? And how closely are we, is the state, is DPH monitoring who they're vaccinating?
Yeah, to answer your first question, all of the vaccine supply that is being administered in the pharmacies right now is coming to them directly through the federal pharmacy program. So we're not allocating out of our state allocation to them any longer. And yeah, I mean, we've worked with them very productively since this began in the middle of December, you know, collaborating to have, I think, one of the most successful nursing home vaccination programs. We got finished with all of our first dose clinics first in the nation back on January 8th. And they were very supportive as well as we worked with them to really try to prioritize the locations of their retail stores they opened, both in our cities, in our high SBI communities, and then also in some of the more rural parts of the state where we didn't have as good coverage with hospitals and other providers. But we do think the next opportunity and requirement here is to make sure that even if the retail location is in a city or in a high SBI community, that we're still taking actions to make sure that appointments are as easily available to people who actually live in those communities as people who may drive in from the suburbs and may have been quicker on the refresh button when, you know, new appointments get loaded into their system. So I think we do have more work to do there with them as the data show, but they've been great partners so far, and I'm sure we'll make progress.
Thank you.
The Waterbury Republican American.
Thanks very much. Can you give us an update on what the vaccine allocation schedule is looking like, and when might the Johnson & Johnson deliveries resume?
You got that, Josh?
Sure. You love the Johnson & Johnson vaccines, Paul. You you ask about that every day.
Well, I got a Johnson & Johnson vaccine earlier this week, as a matter of fact.
Oh, that's excellent. Congratulations.
Well, you were right. I was a little skeptical about getting an appointment. I voiced that to you, and I'll give you your propers.
Excellent. Well, I'm glad you got vaccinated. Yeah, we still don't have a lot of long-term guidance from the White House in terms of exactly when, you know, certain vaccines should ramp up more significantly. We have heard from them, though, that by the end of the month, Johnson & Johnson should be coming back online in larger numbers. The Moderna and Pfizer shipments should continue to ramp up substantially as we get later into March and certainly into April. And as the governor said, I think it's not going to be too long before we have a lot more vaccine in this state than we actually have people who want to take it. And we're going to be having a very different discussion more and more about those strategies we'll need to employ to get the rest of the population vaccinated at as high rates as we possibly can.
And just what does the deliveries look like next week for Pfizer and Moderna?
So we don't have a complete view yet of all of our shipments for next week. We don't yet have visibility in terms of what our federally qualified health centers are going to get through their allocation. But we do know for the state allocation, it's going to go up about another 5% next week.
Okay. And sort of getting back to some of the questions about the sort of equity issues. I was just looking at the map that you guys put out on a weekly basis, and it still seems like, you know, with the large cities that at least with the adjacent towns and suburbs next to them have significantly higher vaccination rates than our large cities. So I'm just wondering, is that kind of any kind of reflection on these early efforts to address these equity issues, or is it a little premature to say? For example, like in Waterbury, 2 weeks ago, 9% of the population had received a vaccine shot. Now it's 13%, and some towns around them are into the 30s. In Hartford, I think it's 11%, and the surrounding communities, it's 22 to 30%. In New Haven, one of its suburbs is up to 35%.
Yeah, Paul, we just got to continue to do a better job of getting the vaccine to these communities, bring them to the people with trusted advocates there. Speaking of Waterbury, schools are open, and yet kids are less likely to want to go to school or can go to school or feel confident going to school compared to a lot of the neighboring towns as well. So there is a lot of fear about, I think, COVID and maybe some misunderstanding about the vaccine, which all that means is we have to redouble our efforts to make sure that nobody is left behind. And you get vaccinated, your teachers in Waterbury are vaccinated, they're calling students, convincing them now's the time to get back into the classroom. Charlene is making a big effort on that in terms of all of our schools. It's one thing to have the schools open, another thing for people to come back, and the same thing with vaccines.
And just the final question for me. I was looking at the sort of the alert status map, and I think it was 107 towns were on red status last week. It's down to 104. Doesn't seem to be moving all that quickly. Is that a concern for you guys? That more towns aren't dropping out of the red zone?
I think you're going to see a lot dropping out over the next few weeks. Josh, any last thoughts?
Yeah, no, I think that's right. As the governor said, though, it's not going to go to zero, but we do think that as the number of cases continue to decline, we should see some more color drain out of that map.
Okay, thank you very much.
All right, let me just say I'm getting the signal right now. First of all, Charlene and Miriam, thank you so much for joining us. You're going to be quite busy over the next month as we make sure that we make a difference in these kids' lives. We talked a fair amount about using advocates to convince you that when it's your turn, get vaccinated. It's safe and effective and makes an enormous difference. Here's an advocate that originally sang the song Jolene.
Me, I'm finally going to get my vaccine. I'm so excited. I've been waiting a while. I'm old enough to get it, and I'm smart enough to get it. So I'm very happy that I'm going to get my Moderna shot today. And I wanted to tell everybody, I think you should get out there and do it too.